Welcome, everyone. We will start our event shortly. Please grab a drink and get comfortable and enjoy our celebration. Hello, everyone. I'm Hilary Siebens, a physician who's been involved with CAPA for over 18 years now, and I'm currently on the advisory board. Good afternoon, and thank you for joining CAPA's 8th annual Medicare anniversary celebration. I'm calling in from Seal Beach in Southern California, and I trust you have a delicious drink on hand and are relaxed. This year, Medicare turns 56 since it was enacted in 1965. This is our 8th annual celebration of Medicare's anniversary and our annual fundraiser. Pre-pandemic, we had in-person meetings in Fresno, Oakland, and Los Angeles. And we're all looking forward to 2022 when we can meet in person again. CAPA is a 501c3 nonprofit organization, and therefore we are prohibited from supporting individual candidates for elected office. However, we can support a cause, and that is what we're doing. Since 1987, we've been advocating for a universal healthcare, single-payer Medicare for all system here in California. We believe that healthcare is a human right. Everyone deserves healthcare. Today, we are excited to hear from all of our dynamic speakers to learn about what is being done at the local, state, and national level to achieve a Medicare for all system. Now, I'd like to name and thank our event patrons. Marianne Brown, Parker Duncan, Robert Gould, Paula and Barry Litt, Don McCann, Bernie Nadell, great, Robin Silver, Alice Steck, Robert Vaness, Janet Winikoff, and Steve Tarzinski. Thank you to all of these and all of you event donors. It makes a huge difference having your support. And now I'd like to introduce our executive director.
Hi, good afternoon, everyone. My name is Beatriz Sosa Prado, and my pronouns are she, her, hers. I'm CAPA's executive director, and I'm calling you from my home in LA. Today, I celebrate, like you, Medicare's 56th anniversary. My beloved father, my hero, passed away this last April from complications of the heart 6 days before turning 78. And at the age of 61, he became permanently disabled after suffering a massive stroke. Because of that, at his age, 61, he was eligible for Medicare then. And thanks to Medicare, my father received the care he needed with hospice care at home until the day he had his last breath. My beautiful mom, who's 74 years old, is also a Medicare beneficiary. And every day I am so grateful that she has an awesome doctor and receives the services and the care, the preventive services and care that she needs and deserves. I can't imagine what undocumented people, especially seniors like my parents, go through without guaranteed, affordable, quality health care. And this is why Health for All is so important to me personally, and it's so important to CAPA's mission. The Health for All Coalition was created in 2014 to advocate for removing exclusions based on immigration status to include all Californians in our public healthcare system. And at the end of June, Governor Newsom and the state legislature announced their final budget, which included a Medi-Cal expansion to all Californians 50 years and older, regardless of immigration status, beginning next year, May 2022. And CAPA is proud to be part of such a statewide coalition that affects progressive changes to expand Medi-Cal to our undocumented Californians who contribute so much to this golden state. And today we'll have healthcare champions speaking to us who have made this specific victory happen in our state. CAPA's mission is to advocate, educate, and organize physicians and other health professionals to support creating a socially just and universal healthcare system that ensures quality and accessible healthcare to all Californians. CAPA's vision is the creation of a full implementation of Golden State Care. That's what we call our vision, which Golden State Care is a unified system of public financing for California. In Golden State Care, so Golden State Care would cover all necessary health costs. It would finance the delivery of healthcare while building upon current private networks. Golden State Care would also cover all Californians from birth to death, and it would be unlinked from the place of employment. Thank you for celebrating Medicare with all of us today. Let's protect it and let's expand it. Whether through your actions and or your generous financial contributions, your support helps CAPA protect Californians' access to healthcare right now in the midst of the COVID-19 pandemic, while we continue to advocate and fight for universal healthcare. I am so grateful for your time and for your attention today. Enjoy the program. And here is CAPA's president.
Hello, everyone. I'm Steve Tarzinski, president of CAPA's board of directors, and I'm joining you from Santa Monica in Southern California. On behalf of CAPA, I warmly welcome all of you to our 8th annual Medicare Anniversary Celebration, and this is our second virtual fundraising event. The pandemic and the economic crisis caused by it has resulted in over 16 million people losing their health insurance due to losing their jobs. The pandemic is a stark reminder that we must unlink insurance from employment and provide it through unified public financing. It has shown the failure of the free market in healthcare. The pandemic also has more strongly than ever pointed out the many disparities within our healthcare system and the need to address them effectively, especially the longstanding racial injustice inherent in our healthcare system. Many of us here have been working for decades to right this wrong. And while unified public financing through single payer cannot alone eliminate the racism embedded in our healthcare system, it will provide a strong platform and incentive to finally eliminate it. A single payer system would also provide the capacity, system-wide coordination, and appropriate infrastructure needed to mitigate and even prevent future pandemics. CAPA is working hard to make that happen in California and in the rest of the nation. The establishment of Medicare in 1965 was a key step in advancing to universal coverage in our country. It's fitting that we mark each anniversary of Medicare's passage into law. We are grateful for your ongoing support of CAPA, which helps make our work possible. Here are just a few brief highlights of our work. Our roadmap to Golden State Care is our proposal for a strategic, approachable, and realistic way to get California to a single-payer system. CAPA is working to make sure that the Healthy California for All Commission expeditiously and effectively completes its task of providing a plan to the governor and the state legislature for a unified system of financing. CAPA wants to complete its 2 mapping projects, mapping our membership by legislative districts and by medical specialty, which will greatly enhance our impact. And we are developing and are close to completing our ambassador program, which will train expert health policy speakers. And we're also working on a business outreach webinar project. And we continue our work to build our dues-paying membership and our supporter base, which includes you. And we continue to work with our partners on a range of short and medium range reforms that will improve access, quality, affordability, and equity in our state's healthcare system. All this as we keep our eye on the ultimate prize of a single-payer system. We count on your generosity to help us. And please know that you're not merely giving to CAPA, but you are giving through CAPA to realize your values as well. Thank you for being here today and enjoy the program.
There we go. Can you hear me? Good. CAPA is a 501(c) organization, but unlike other nonprofits in healthcare, the California Physicians Alliance is not in the business of discovering a cure for cancer, AIDS, lymphoma, leukemia, ALS, and other serious diseases that also need funding. However, we are in the business of doing the best we can of making sure that those who suffer from those diseases and other ailments, from the common cold to life-threatening diseases, are able to get the health care they deserve when they need it. We are in the business of assuring people retain health care that they already have, getting people covered via advancing legislation that would do just that, and ultimately bending the arc far enough to achieving universality, single payer, or because we are celebrating a special anniversary, Medicare for All, which when achieved will surely bump America's national parks into second place as being America's best idea. Sorry, Ken Burns. Several months ago, President Biden didn't say healthcare is a human privilege. He said it's a human right. Yet what kind of right has such a high price tag? Why do some have to choose between paying for medicine or paying for food or a roof over their head? What kind of right is dictated mostly by private industry? What kind of right is so unaffordable that many, including people who are paying hundreds of dollars a month or more to keep themselves and their families insured, even with help from the health exchanges and COBRA, something has to change. We're all here this afternoon, so we can all be agents of that change. Let me tell you what you can do. First, go to our website and join CAPA. Second, become a sustaining member, and most immediate, make a donation now by holding your phone camera up to the QR code and scanning it. It will take you right to the donation site. Now, I know it's been a tough year for many of us, financially and health-wise. I include emotional and mental health as well. For those struggling, sit back and enjoy our great program today, our line of speakers, and give what you can or not at all. For others in the audience, let's be honest, it hasn't been that tough of a year financially. Ironically, with the stock market at record-breaking highs, you might have actually done quite well. It is possible that you are in that category and can help us achieve the goal of advancing the roadmap to a publicly financed system of healthcare and end the plight of the uninsured and underinsured by helping CAPA work to give those folks health security that most of us attending this meeting are lucky enough to have. I'm asking if anyone out there who is fortunate enough to give not just $56, but to misquote Beyonce, put a ring at the end of it and donate $560 or more. Do yourself proud. Your kids won't miss it, and neither will you. Time to be a big shot. For the other 99%, please give what you can. $250 makes you a patron. $150, $100, or the price of last year's admission plus $1, $56. Donations are like a deep tissue massage. It hurts a little or a lot, but in the long run, you feel much better. In that vein, I hope this day you all choose to get Rolfed. CAPA thanks you. More importantly, I'm sure people who rely on us, who don't even know our name or what we do, who rely on our political action and our largeness, I'm sure they thank you too. Enjoy the next hour or so of programming where our speakers will be adding some energy and empathy so that by the end of it, you will even decide maybe to up your donation. We're going to let you do that. Again, from the bottom of our hearts, thank you for doing what you can.
It is with
Are we ready?
Hi, everyone. Just please give us a minute. Give us 1 minute. Okay, actually, at this point, I'd like to ask Dr. Yelenia Palacios, if you could go ahead and speak.
Yes. Hi, V. Good afternoon, everyone. So happy to be here. My name is Dr. Yelenia Palacios, and I have the pleasure of introducing a documentary called Power to Heal, Medicare and the Civil Rights Revolution. Now, this film, it's so powerful and important on just how the civil rights movement, especially in its medical arm, and the federal government came together to desegregate hospitals to get funding from the Medicare program in 1965. Now, something that was new to me most recently and to others, if you're unaware, Medicare was a first step to challenging systemic racism. Now, the disproportionate impact of COVID-19 in Black and Brown communities is just one example of the impact of a long line of historical and structural inequities that we face in health and healthcare in the United States. It reminds us both that we can and have won victories and the struggle is far from over. Now, here's a clip of the documentary.
Leah, can we get the sound? Okay. Leah is one of our CAPSA coordinators, and she will introduce her in a bit later on in the program. And she is working backstage. She's gonna stream this clip, and I'm wondering, Leah, if the audio is working now.
Did you guys hear that?
No. Okay, while Leah can figure that out, we'll just move on. But for this clip, if you have not seen this powerful documentary, CAPA and CAPSA will have a joint event later on this fall, and we will invite you all to watch this together. So in the meantime, while that gets worked out, let's continue with our program. So, yes, okay. So there we go. Let's see. Okay. Can everybody see me? Yeah, okay. All right, great. Thank you. Okay, so our first speaker of the day is Dr. Jared Kaminsky. During his 32 years at the UCLA Fielding School of Public Health, Dr. Kaminsky, who is now a retired professor in the Department of Health Policy and Management. And he is also a senior fellow at the UCLA Center for Policy Research, has been a leading voice in California and nationally on issues related to healthcare reform and expanding access to care, including the expected and actual impacts of changes under the Affordable Care Act. He co-led the development of the California Simulation of Insurance Market Model, which is used by Covered California, our state's ACA's created health insurance marketplace, to forecast the eligibility, enrollment, and expenditures under this landmark law. And prior to that, Dr. Kaminsky was vice chair of the cost impact analysis team of the California Health Benefits Review Program, which assesses proposals by the state legislature to expand mandated insurance benefits. Dr. Kaminsky was the UCLA Fielding School of Public Health Associate Dean for Academic Programs from 2001 to 2008, and the UCLA Center for Health Policy Research Director from 2012 to 2018. And here is Dr. Kaminsky. Okay, 1 minute. We are doing this sort of like a meeting. So by this point, all of you are familiar how that goes. So here it is. And here is Dr. Kaminsky.
Good afternoon. It's my pleasure to be here today via video to celebrate with you the 56th anniversary of the Medicare program, the greatest social insurance program for healthcare that we have in this country. I want to make 2 quick points and share with you today. The first is that, just a reminder of the history of the Medicare program. In 1951, Isidore Falk and Wilbur Cohen came up with the idea of Medicare as an interim step to national health insurance in the United States. They identified seniors as the target population to begin, because at that time they were vulnerable and less likely to be insured, because health insurance was generally not provided as a retirement benefit. They also were a needy population that was deserving. That is, they were our parents and our grandparents. And so Falk and Cohen realized that political support for Medicare depended on this sense of unity, that we were helping our families and helping ourselves, and that this was key to the ultimate success of the Medicare program. That's a lesson that I think we need to continue to remember today, that healthcare for all, Medicare for all, and expansion of the Medicare program to the rest of the population, which was the original intention of Falk and Cohen, is something that will unify us and not divide the country. The second point that I want to emphasize is related to the issue of division. One of the concerns in the pandemic is that public health measures have become politicized and weaponized by opponents to vaccination and to simple public health measures like wearing a mask. The latest example of this is an article that was published just the other day in the LA Times that said, is it time for us to pass on the cost of healthcare to the unvaccinated? Now, I understand the impulse, and I also understand the frustration that many of us in the public health field feel towards vaccine hesitancy and towards deliberate efforts to undermine public health measures during this pandemic. But I caution all of us not to act on the impulse, the frustration that many of us feel in public health towards those who remain unvaccinated. I urge us not to move in the direction that's suggested in this article. This may be the worst example of public policy that I've seen in a generation. If we move forward and seriously consider denying health benefits and healthcare insurance or healthcare coverage for those who are unvaccinated, it is the slipperiest slope that we could possibly be going down. And I urge all of us to resist the temptation to lash out at those who are not vaccinated and weaponize health insurance as a way of punishing people who remain unvaccinated. There are so many other conditions that we could identify, and you can fill in the blank with any other condition that you might imagine, that we could possibly argue for policy, from a policy perspective, that if we excluded people who had this condition because they quote unquote brought it on themselves, then they should not be entitled to health insurance coverage for that condition. None of us want to go down that path. That is exactly the opposite of the efforts that all of us have fought for decades, which is to be more inclusive, to cover everyone and to cover all possible health conditions. So thank you today for being at this event. Thank you for the opportunity to talk with you briefly. Continue to fight the good fight. And I look forward to seeing all of you at the 57th anniversary of Medicare next year. Thank you very much.
Great. Thank you so much, Dr. Kaminsky. It was a pleasure to have you speak to us. I definitely, and I look, professionally, I reach out to Dr. Kaminsky for his advice. He is also a CAPA advisor. So at the moment, I'd like to ask Dr. Palacios, do you have the clip ready? We can go ahead and try it off of your screen.
Yes, perfect. Let me go ahead and select that now. I'll be trying to share
Great.
right now. Here we go.
For most of America's history, a system of racial segregation dictated every aspect of life. In no area was this more true than in healthcare.
You think about the civil rights movement, you think about housing, public accommodation, education. But I think the story hasn't been told often about what happened in terms of the institutions of medicine. That's an unrevealed part of the history.
In 1965, as the civil rights struggle escalated, Black Americans were in the streets fighting for justice and equality. They were being attacked and killed. But a different kind of violence was taking thousands of Black lives every year. Segregated medical care was a brutal reality for Black Americans.
Negroes had one ward. You were dying from cancer, you were there to have a baby or whatever, you're on the same ward.
Everything was separate, not just the hospital, but physicians' practices. I was the only Black pediatrician in the entire state.
People were dying as a result of that segregated system.
The 1964 Civil Rights Act tied federal funds to desegregation. Now Medicare, with its promise of federal funds, created an opportunity to end the shocking inequalities in medical care. This is the remarkable story of how civil rights activists and the federal government, working together, desegregated thousands of hospitals practically overnight, bringing life-saving care to millions of Americans. This little-known story reveals the role of countless people who never took center stage, but whose shoulders we stand on.
Great, great. So like I said, this fall, CAPA and CAPSA will have a joint event, and we will invite you all to watch this film if you have not already. Okay, next, I would like to see, so, just a little note, in your upper right corner, you can click on speaker view or gallery view. I would recommend put us all on gallery view so that you can see who is on the call today. And for our next speaker, give me a second. Okay, sorry about that. Again, this is, we're in our call, so I have to, as you already know, we have to move around in screens all the time. So, okay, so our next speaker is our newest board member. Dr. Shapiro is also known as Dr. Shaps. He has a passion for, and actually, Dr. Shapiro, can you wave at us? Let us know who you are. Okay, great. Dr. Shapiro has a passion for always being converting health information into action and improving the well-being of our communities. Born and raised in Mexico City, his experience as the liaison between Mexico and the World Health Organization after medical school taught him that the healthcare systems that we have in our lives need to be connected with the most critical aspect, with the community itself. Dr. Shapiro began his journey in policy and advocacy as a pediatric resident at Mount Sinai Children's Hospital in Chicago. Dr. Shapiro regularly appears in several national and international outlets such as CNN, CNBC, Telemundo, Univision, Estrella TV, and the radio, sharing information about emerging healthcare topics and, of course, about COVID-19 and children's health. I am honored to introduce Dr. Ilan Shapiro.
Thank you so much. We actually, Ms. Beatriz Sosa Prado, she has been an amazing ally for many years. And nice to meet you, everybody. Bienvenidos, familia. I'm here for everybody. I come from a small city, as you heard, called Mexico City, and I have seen a lot of things. I went to little pueblitos, little towns. I went and worked as a liaison between Mexico and the Ministry of Health for the WHO. Then I have seen how policy on an international level and a local level talk to each other. And I have also seen right now with COVID-19 how social determinants of health can actually kill communities. A lot of people have asked me, like Dr. Shapiro, what's happening with underserved communities right now with COVID-19? Is it genetically modified to actually destroy communities? And sadly, I tell them it's worse than that. It has been humans that have been creating these type of problems and barriers to other human beings for decades. Then whenever we get stressed, knowing that our communities are suffering from depression, anxiety, diabetes, lack of social justice, lack of social environment issues, and we combine that with not having the possibility to take care of themselves, the question is, when do we stop? It's clear right now that we were extremely lucky with H1N1 in 2009. We were lucky. And right now we're seeing what a pandemic can do to our communities. And this type of programs, this type of healthcare, it's not a right. It's actually the morally correct thing to do. We don't seek a doctor in general terms when we are having fun, or if you're a Saturday night, you don't go like, oh, let me call my pediatrician, or let me call my internal medicine doc and see how they are doing because I have a random question. No, we need to have this type of services, one, to prevent problems. That's where we need to move forward. And secondly, to make sure that if there's a problem, we need to start creating something. That's why, I start with an eye and with a heart. And let me tell you why. Because right now we are creating a lot of networks. I have seen right now in LA County and Orange County how communities have been decimated, destroyed. If we want to create a better future for humanity, we need to give the example. And part of it is actually going to go with, public health. And that's kind of the things that we need to be doing, all of us. And that's why I am very blessed to be part of this amazing board, to make sure that we are amplifying the message. We're putting equity on the table. We're talking about social justice. And most importantly, we're talking about human beings. And I cannot get tired of repeating this phrase. At this moment, we need to make sure that we're vaccinating our communities against fear with a dose of truth. Then familia, let's do it. Let's do this. And if you can do $1, $4, $500, if you want to do $1 million, we will never say no to you. And please join us with your heart, with your people can actually donate 1 hour of their time, $1 of their time. We're here for everybody, and we need your help. And this is the moment to do it. Then, familia, let's fight this. And thank you so much, Steve, for absolutely your heart, your leadership, and I don't see Professor Bo, but if you're there around this, greetings to everybody. Then I'm here, Dr. Ilan Shapiro, always here for you.
Great. And for our next segment, Dr. Hillary Stevens will be beginning the CAPA Awards.
It's Jim Manja is CEO of St. John's Well Child and Family Center. On behalf of CAPA, I am really honored to award Mr. Manja our Leadership in Healthcare Award for COVID-19 vaccine equity, which under his leadership was achieved in South, East, and Central LA. Mr. Manja, your work has been outstanding, and besides preventing disease and illness, you are providing inspiration and hope for the entire health justice movement.
Thank you. Thank you so much for this. And I'm really honored to receive this award today. South LA and East LA were really the epicenter of the pandemic. We saw so much suffering. We were testing thousands of people a day at the height of the pandemic last year, more than 30%, 35% every single day. Were coming back positive. And it was primarily the Black and Brown communities, frontline and essential workers who were not being given PPE and were not able to shelter at home and continue to go to work and get infected. And so as soon as we heard and read about the approval of the vaccine and the parameters, we immediately bought the last 3 freezers to store Pfizer and the last 7 freezers to store Moderna in the country, so that we would be prepared and ready to vaccinate the communities of South LA and East LA. And at first, the vaccines were sent to the West Side, to UCLA and Cedars. So we got 100 organizations, Black ministers, Black churches, immigrant rights groups to sign on to a letter demanding that community health centers and that South LA get the vaccine. And within days, we had the vaccine and started vaccinating South LA, moved into East LA, opened up the East LA Civic Center, and started vaccinating essential workers and frontline workers in partnership with SCIU and the County Federation of Labor. By March, we had opened 26 vaccine sites, and we had 3 mobiles that were doing pop-ups 6 days a week. And we were vaccinating over 5,000 people a day. 96% of all the vaccines that we've done so far have been done in the under equity zip codes. 54% of the folks who we vaccinated are Latino, 28% African American, 12% Asian. We've now vaccinated 300,000 people. And we're now moving to target those most hesitant and those most unable to get the vaccine. A lot of what we're seeing is people who are working 3 jobs and are raising 4 kids, and they don't have time to take off of work. They don't get sick time. There isn't a state law that allows people to take off time if they have a reaction or side effects from the vaccine. So many of the folks that we're seeing who are hesitant because they don't have the capacity to take off of work. So we're now really moving to micro-target those hard-to-reach populations, immigrants, people experiencing homelessness, transgender community, and low-income families. And so it's really been an honor. It's been a trek to get to 300,000, and obviously now at the booster and the 3rd shot, we'll be vaccinating a lot more. But we're continuing those 26 vaccine sites and community pods, points of distribution, and all of those partnerships that have really allowed us to vaccinate South LA and East LA. So thank you so much for the recognition, and we'll continue to do this vaccine work on the ground until we beat COVID.
Hey, great. Congratulations, Jim Manja. It's a pleasure to have you as one of our CAPA advisors. And so now, everyone, if we were in person, we would be clapping, right? We would be saying hello. We'd be so happy. And we are happy now, but go ahead and click your reactions. If you go to the bottom right of your screen, you'll see the little happy face emoji. And then, you can, clap or give your impressions. We would love to see that, especially if you're all on gallery view, we'll be able to. Okay, so next we have a very special award, and this will be introduced by Dr. Steve Tarzinski, CAPA's president. So Steve.
Thanks, B. And again, thanks to Jim for his incredible work. I think when public health scholars and historians look at this period, your leadership and all the people that you and organizations you work with will definitely be highlighted. So thank you again, Jim. In its 33-year history, CAPA has never given a Lifetime Achievement Award, and it's not something we'll be doing every year. This will be a special and rare award that recognizes exceptional contributions over a lifetime of distinguished service. We're deeply honored to present this award to Dr. Don McCann, who is a longtime CAPA member, a CAPA donor and supporter, and most importantly, a member of the CAPA Advisory Board, to whom we turn often for advice and guidance. Don earned his BA at UC Riverside in 1953, and then earned his MD degree at the University of California, San Francisco in 1963. He was drafted under the doctor's draft and served in the United States Army as a medical officer for 2 years during the buildup to the Vietnam War. For over 3 decades after that, Don practiced as a family physician with his father and his brothers in San Clemente and San Juan Capistrano. Their practice took care of everyone, including Medicaid and undocumented patients. I asked Don how he got his social consciousness, and he credited his father, whom Don described as a Fabian socialist and great admirer of Franklin Delano Roosevelt, who thought it was important that everyone had access to health care regardless of ability to pay. And that was long before Medicare and Medicaid were enacted. Don is a charter diplomate of the American Board of Family Practice and a charter fellow and life member of the American Academy of Family Practice. He served as chief of staff of his local community hospital and even as the board chair of a local community bank. Don was also elected to the San Clemente Wall of Honor by the city council. After he retired from practice, as Don likes to state, he has dedicated his remaining productive years to healthcare reform activism, speaking and writing extensively on universal healthcare and other policies for expanding healthcare coverage, access, and affordability as well. In addition to his engagement with CAPA, Don served as president of the Physicians for National Health Program for 2 terms and is currently the PNHP Senior Health Policy Fellow. He's also a recipient of PNHP's Quentin Young Activist Award. Most important of all, Don wrote the daily health policy update called Quote of the Day, or QOTD to us policy wonks, taking an excerpt from a news story, important health policy study, or a major report, and commenting on the significance of the single-payer healthcare reform movement. Over the years, Don posted over 5,000 commentaries. I myself have learned so much from these commentaries, and as I know many people have. Don's been married to Sandy McCann for over 60 years. They met when she was a nursing student and Don was a medical student. And they've had 4 very successful children and 9 grandchildren. So I'd like to extend our congratulations and our gratitude to Dr. Don McCann. And Don or Sandy, if you want to say a few words.
Dr. McCann, I'm trying to spot you from all the little screens here. Where are you?
You see him.
I am here.
Hi. Congratulations.
Well, thank you. I, of course, am greatly honored to receive this award. You did get it to be by mail before. Let's see if I can read it. Lifetime Achievement Award for healthcare justice. And I am deeply honored to be considered for this by my colleagues who I've had so much respect for and worked so closely with all these years. I have to confess that I'm not quite all there. I've had a couple of strokes and have partially recovered, but I still have cognitive and memory deficits. But I have not lost my passion for healthcare reform. I did have to drop the quote of the day, but it was taken over by Jim Kahn and his colleagues, and is issued every day as the Health Justice Monitor. And you can find that on the internet. And I recovered enough that they've asked me to provide some of the entries. And so every once in a while, you'll see my name there. So I'm still around, even though I'm not quite all there. But it's, hearing about my father and the way he raised me, I think you'll understand what this is and how I can never give up trying to achieve healthcare justice for all. So I really thank all of you for this great honor.
Thank you so much, Dr. McCann, for everything that you've given us and you continue to do. Great. We have our next speaker, also introduced by Dr. C. Tarzinski.
Great. Thank you, Bea. So our next speaker will be Assembly Member Ash Kalra, who represents California's 27th District, which encompasses approximately half of San Jose. In 2016, Assemblymember Kalra became the first Indian American to serve in the California legislature in our state's history and was reelected to his third term in 2020. Assemblymember Kalra serves on a number of committees in the state assembly. He's a leader on issues ranging from criminal justice reform to environmental protection and has championed legislation on healthcare sustainability, housing affordability, growing transportation infrastructure, and expanding economic opportunity for all. As a longstanding supporter of a single-payer healthcare system, Assemblymember Kalra this year introduced AB 1400, the statewide legislation also known as CalCare, which would guarantee comprehensive, high-quality healthcare for all Californians as a human right. And CAPA is working with him and his staff on moving this legislation forward. And Assemblymember Kalra, it's my pleasure and honor to have you join us today. So please take it away.
Thank you so much for that very kind introduction, Dr. Tarzinski, and thank you to Executive Director, Dr. Sosa Prado, and CAPA for inviting me. I'm always have great admiration for the work that you do and for the work of the organization for so long to advocate for healthcare justice for everyone. When we heard or saw the video, one of the quotes that was flashed is one from Dr. King: of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman. And of course, he said that under the context of the segregation that had been occurring in hospitals and in our healthcare system. And the reality is during the civil rights movement, a lot of what was fought for was kind of the first step of many. Dr. Kaminsky spoke about as it applies to Medicare. And much of what was fought for, whether it was healthcare, economic and worker justice, or voting rights, we see that even those incremental steps that were fought and won in the 60s, over the last 30, 40 years, they've been under attack. And that includes access to healthcare. And so not only are we not living up to the promise of Dr. King as we speak today on the anniversary of the March on Washington, but we actually are losing ground. And that applies to a number of different facets in our society, and particularly as it applies to healthcare. And we know that we have so much inequities and inequalities in our healthcare system. And looking at COVID, the proof is right there, where we've seen Black and Latino life expectancy drop dramatically over the last year and a half, because Black and Latino populations are suffering due to COVID. And it's not just because there's a higher propensity of essential workers that are Black and Latino, but the precursors, and I don't need to tell all of you this as physicians and those in the healthcare industry, but the identifiers that make you more susceptible to COVID, and certainly more severe cases of COVID, are more prevalent in Latino and African American communities. And it's because our healthcare system has been unjust and has had racist outcomes for generations, and we have not rectified that. And so it's so important for us, especially in the midst of this pandemic, as we're seeing a light at the end of the tunnel, but we're certainly still in the middle of it. Because of our governor and because of the leadership in our state, we've been able to have better outcomes than many other places. But as we heard from our honoree from South Los Angeles, a lot of that took work from so many of you in the community to push back against the instinct to kind of go fall back on the status quo and give the services to the wealthy first. We've had to push back on that in the legislature as well. And so I would just say this, right? As we are looking forward, let's recognize that our single payer healthcare system is the road forward that's going to bring healthcare justice to everyone. Even right now in Washington, D.C., as they're debating expanding Medicare to include vision, dental, long-term care, who's pushing back? The insurance companies. And why? Because they're worried about losing their customers that are buying supplemental Medicare insurance. And so let's look at the motivations of those that push back against us. When we seek at the federal level of lowering the Medicare age, we also see furious opposition from those that are profiting off of our community, because they don't want the government to be able to provide this high quality healthcare and take profits away from them. California has absolutely the opportunity to lead, as evidenced by my colleagues that will be speaking later. Dr. Arambula, an ER doctor, Maria Elena Durazo, Senator Durazo, who is a renowned labor leader. They have been steadfast in advocating for expansion of Medi-Cal to undocumented workers. And we've seen successes because of it. But just because we may have single payer tomorrow doesn't mean that we don't advocate for as much expansion of healthcare today. But ultimately, those incremental changes that expand healthcare to more of our community, to our undocumented community, to workers that are left without healthcare because we ridiculously attach healthcare to employment. The reality is that those incremental steps that we all can agree on are the proof that single payer healthcare is the destination we need to arrive at, because every time we expand access, we all know it's the right thing to do. So I'm so grateful to CAPA for continuing to beat the drum on single payer healthcare. I'm very grateful to my colleagues, Senator Durazo and Assembly Member Arambula, who continue to fight for greater access to healthcare for all, including our undocumented brothers and sisters. And I'm grateful to other colleagues, including at the federal level, like Congressman Ro Khanna, who's been a partner in justice in advocating for single payer healthcare across our nation. So thank you all so much for inviting me. I look forward to continuing to march with CAPA side by side, because there's no doubt we cannot beat back the deception and lies that come from opposition without the expertise of our doctors saying, yes, we can make this happen. So for that, I am incredibly grateful. Thank you all so much.
Thank you so much, Assembly Member Kalra. It was a pleasure to have you today. we have a really awesome speakers today joining us. And again, I remind you to please feel free to generously use the emojis. I know I use the hearts and the clapping a lot. Okay, so next, our student section, California CAPA student section, California Health Professional Students Alliance, aims to cultivate leadership and advocacy skills among health professional students so that they can affect change in the healthcare system, primarily through grassroots efforts, education, and community outreach in support of comprehensive, high quality, accessible, guaranteed, and affordable healthcare for all here in California. And next, I'd like to introduce our CAPSA co-coordinators, Leah Lopez and Yesenia Buenrostro Ramirez. So Leah, let's have you introduce yourself.
Hi everyone, my name is Leah. Nice to be here and be present with you all today. I'm currently calling in from Davis, although I'm originally from San Pedro, which is a small port town in Los Angeles. I moved to NorCal to obtain my undergraduate degree in biological sciences with minors in public health and psychology. And I'm proud to be breaking barriers as a first-generation Latina in STEM, pursuing a career in medicine. Currently, I'm spearheading Project Whitecoat as CAPTA co-coordinator in recruitment, retention, and healthcare for all advocacy groups. CAPTA's Project Whitecoat mobilizes pre-health and medical students in communities across the state to improve health coverage. I'm very grateful to be a part of this team and continuing health policy advocacy. And I'll go ahead and turn it over to my co-coordinator, Yesenia.
Hello, everyone. My name is Yesenia Buenrostro Ramirez. I'm calling in from Selma, California, in El Valle Central, Central Valley. I graduated from Fresno State in 2020. I earned my bachelor's of science in kinesiology and a minor in deaf studies. I'm currently completing an informal postbac, and as I pursue my career in medicine as a future doctora, I'm blessed to be a co-coordinator here with CAPSA and having Aaliyah alongside me. And so personally, I have seen my dream come true to have CAPSA have a summer internship this summer. And I'm so glad that Leah has helped me direct that. We had a successful summer internship with 8 interns. And yeah, thank you so much for having me here.
Excellent, great. And it really is a pleasure of mine. Yes, I love seeing the emojis, clap. It's a pleasure of mine to work with these amazing students and future doctoras. So next, we have our other speaker, Mr. Anthony Wright. Since 2001, Mr. Wright has led the state and national efforts to win comprehensive health reform as the executive director of Health Access. And Health Access, if you did not already know, is California's healthcare consumer advocacy coalition. And it brings together dozens of other member organizations representing seniors, people with disabilities, children, immigrants, communities of color, healthcare professionals, people of faith, labor, women, low-income families, and communities throughout the state. Anthony Wright led California's coalition efforts to pass the Affordable Care Act and state laws to implement and improve it, as well as campaigns to successfully pass the first in the nation laws to stop hospital overcharging of the uninsured. And here is a clip of Mr. Anthony Wright. So Leah, do you have that ready for us?
My name is Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. And I'm really pleased to be here with our great partners at the California Physicians Alliance. We've been really pleased to be working with CAPA over many years toward these goals of getting to a universal healthcare system. We're really pleased to be celebrating the anniversary of Medicare. And not just as a program that provides life-saving medical care to millions of California seniors and people with disabilities, but the vision of the program as a platform for getting to that goal of universal health care.
Let's see, we have a frozen screen. Okay, I think that you'll try again. Is that
Yes.
right? Okay. Great. Thanks, Leah. Okay, thanks everyone for your patience. While we get that working, why don't you go ahead and grab your drink? I just have some water with me. And like Hillary said, we trust that you have a nice snack with you. And let's see, how are we doing, Leah?
Okay, gonna reshare the screen right now.
Okay, excellent.
I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. And I'm really pleased to be here with our great partners at the California Physicians Alliance. We've been really pleased to be working with CAPA over many years toward these goals of getting to a universal healthcare system. We're really pleased to be celebrating the anniversary of Medicare. And not just as a program that provides life-saving medical care to millions of California seniors and people with disabilities, but the vision of the program as a platform for getting to that goal of universal health care. There's real opportunities this year to actually take additional steps at both the federal level and the state level on the programs like Medicare, like Medicaid, like the Affordable Care Act. We've been proud to work with CAPA and CAPSA on working to expand our Medicaid program here in California, expanding coverage to all, including children, young adults, and now all Californians 50 plus who are income eligible, regardless of immigration status. We're proud to have made that big investment this year that will start covering another 250,000 Californians 50 plus starting May of next year as part of our Health for All campaign. We're also proud that CAPA is in the steering committee and leadership of our Care for All campaign, which takes that and other efforts to try to build a more universal, equitable, and affordable healthcare system, working, for example, to expand subsidies in covered California, subsidies that have helped hundreds of thousands of people, and that served as a pilot program for the new subsidies that are coming in the federal packages that are helping people hundreds or even thousands of dollars afford their coverage. The fight in Congress right now is whether we can make that affordability assistance permanent, whether we can set into law whether people have a right to not have to pay more than a certain percentage of their income for coverage. And that's what's in the budget reconciliation fight at the federal level right now that we need your advocacy on, along with some key improvements on the Medicare program that we're celebrating today. Ways that we could improve benefits, add benefits to the Medicare package, like dental and vision and hearing, that we can improve the Medicaid program and allow the expansion in those states that have resisted it, improve affordability, and finally take on the issue of prescription drug prices and allow the government to negotiate for the best possible rate, which we hope would provide a model for what we'd eventually want to do in a single payer system overall. That's what we're fighting for at the state level. That's what we're fighting for at the federal level. And CAPA has been a key partner in these efforts. And it's not just about getting people, more coverage, more care, but it's about setting the groundwork for finally getting to a universal single payer system. I've been pleased to work with CAPA and its leaders on its roadmap, which I think has a lot of important ideas about how we get closer to that goal. And it has informed my work as a commissioner on the Healthy California for All Commission, which is really trying to flesh out what the plan would be to get California to that goal and how we get there. So we really appreciate the partnership with CAPA. We are really excited to be working here to celebrate Medicare, and really appreciate CAPA's organizing, its vision, its work over many years to both do the work to try to build political momentum, to build policy infrastructure, and to put forward the vision that hey, everybody should be in, nobody should be out. We need a universal, a quality, affordable, equitable healthcare system. And just congratulations to CAPA, and keep up the good work. Thank you.
For that, sharing that clip, Leah. So I would like to say that I'm very honored to introduce our next speaker as a fellow constituent of Assembly Member Dr. Joaquin Arambula. He's the author of AB4, Full Scope Medi-Cal, which would encompass all undocumented adults, and it has been considered in the Health for All bill. So Dr. Joaquin Arambula was first elected in 2016 to represent the 31st Assembly District in the Central Valley, the Valle Central, which I'm a part of. And he is the first Latino physician elected to the California State Assembly. Arambula's experiences as an emergency doctor in Selma and in Fresno County forged his determination to improve health care for all the people here, especially the most vulnerable. He has the emotional and financial hardships. He's seen the emotional and financial hardships of the struggling people with illnesses, and he has seen that they could have been prevented with access to quality healthcare. So Arambula believes that healthcare is a fundamental human right. Since his election, he has been a forceful advocate in addressing the dire shortage of physicians in the Central Valley. He has authored legislations that improve health and mental health services, but he also has been diligent to include measures that ensure transparency regarding management of these services and their cost. He is also author of AB4, Full Scope, as I mentioned, which would be Medi-Cal for all undocumented adults. Here is Assembly Member Arambula.
Okay. Leah, I also have my video. Okay, there we go.
Member Dr. Joaquin Arambula, and I'm humbled to be joining you today. First, I want to thank the California Physicians Alliance for inviting me to be a part of this anniversary celebration. I want to thank all of you who are participating in today's event for your continuous advocacy and for being strong supporters of AB4, Health for All. Thank you for being a part of this movement. We all agree that healthcare is a human right. This year, we had some major wins in health and human services. As the chair of Budget Sub 1, I oversee 1/3 of the state budget and was pleased to see some major investments in this area. The inclusion of 50+ in Medi-Cal expansion is a huge victory for California. It is a victory for our undocumented community who contribute to this state and who finally will be able to obtain health coverage. It will cover over 200,000 undocumented elders and seniors. As a doctor working in an emergency room for over 10 years, I saw firsthand the devastating consequences of not having health insurance. For many of my constituents, the ER was the last resort, and this pandemic has magnified existing health disparities for marginalized communities, with social determinants of health serving as the powerful driver of these health outcomes. This year's budget takes extraordinary steps to address these health disparities caused by social determinants of health by changing the system that 1/3 of all Californians rely on for healthcare, by streamlining, transforming, and foundationally changing Medi-Cal service, delivery, and financing in the CalAIM Advancing and Innovating Medi-Cal proposal. CalAIM invests in population health management, prioritizing preventative and wellness services, and helps to identify and mitigate social determinants of health. It also supports in lieu of services, which allows Medi-Cal to cover housing transition navigation services, asthma remediation, and housing deposits. It also establishes the enhanced care management, allowing us to address whole person care and provide much needed services to our highest utilizers. This budget also invests in the Health Profession Career Opportunity Program, which will address the urgent and growing need of California to expand its pool of dedicated, hard-working, diverse workforce. Yo no puedo ver a mi gente solo, and I am so glad and hopeful that reinforcements are on their way. We have learned from this pandemic that the health of each of us is dependent on the health of all of us. I am so pleased to join you here today in your celebration. Thank you again for having me.
So hi, I am Abby Arnold, and I'm a board member of CAPA. I'm a non-physician board member, and very proud to be part of this important organization. I am going to introduce our next speaker. We are honored to have with us today State Senator Maria Elena Durazo, whose district encompasses the Los Angeles neighborhoods ranging from working class East Los Angeles to upscale Larchmont, the super hip areas of Silver Lake, Echo Park, the Arts District, and East Hollywood, and what I think of as the United Nations of Los Angeles, including Chinatown, historic Filipino town, Little Tokyo, Thai town, and Little Armenia. But Senator Durazo represents more than her district. She represents all the immigrants and working people in California who do so much work. They clean our hotels and convention centers, they cook our meals, they staff our airports and sports arenas. Maria, I've known Maria Elena for many years. She began her life as a migrant worker with her family, and then became an organizer with the International Ladies Garment Workers Union. That union became the Union of Needle Trades, Industrial, and Textile Employees, or UNITE. Within a few years, she led the transition of the Hotel Workers Union, HERE Local 11, to become more responsive to its majority Latino membership. She became an international vice president of Unite Here, which was a merger of the two unions, and that's what the union's called today, Unite Here. Local 11 is the predominant union in Los Angeles area politics, and I've worked closely with Maria Elena over the years to make my city of Santa Monica a city where the majority of hotel rooms are now staffed by union workers, and where those housekeepers have strong local protection from sexual harassment and other workplace dangers. Senator Durazo was the first woman to lead the Los Angeles County Federation of Labor, where we put together a program to sign up union members, their families, and their friends for the initial rollout of Covered California. She was the vice chair of the Democratic National Committee and a national co-chair of the Barack Obama presidential campaign. Senator Durazo is a national leader for guaranteed health care for all, and together with Assemblymember Arambula, she led the fight in California to extend Medi-Cal coverage to undocumented seniors, which was, the first step and consistent with CAPA's roadmap to Golden State Care. I'm very proud today to introduce my friend and comrade, Senator Maria Elena Durazo. Thank you so much for joining us, Maria Elena.
Thank you, Abby. And I was with you all up to a few minutes ago in face, as much as we could be face to face. And I'm sorry I lost the connection, but thank you, Abby, for the many years of working together. We've been through some real battles, and we won them. Come hell or high water, one day at a time, one step at a time, we won them. And thank you to all of the CAPA, your leadership, Steve, Bill, others who are playing a leadership role, Yelenia, Yesenia, Beatriz, all of you. I appreciate you so much. I want to do a special shout out to my friend Jim Mangia. I worked with him for many years, whether it was to make sure that workers get a decent wage at his own clinics. He never, ever hesitated. He was always ahead of everybody in raising wages and at the same time providing healthcare needs for our community. So thank you all. Thank you for hosting this event. I was at a workshop that our dear friend Reverend James Lawson holds on a monthly basis, and he was talking about the anniversary of Medicare, and he was talking about the nonviolent strategy movement and philosophy, and how that led to civil rights gains and successes, and that led to our Medicare. So they're all connected. Our movements are connected. If we're smart enough to connect them, we can get so much more than some of our demands. We can get far more. And of course, there's nothing like a just and equitable healthcare system for all. I learned the value of it having been a union organizer, primarily with immigrant workers. And those men and women made it clear every single campaign, no matter what their wages were, which had to be increased, they always made healthcare the number one demand, the number one issue. And in face-to-face negotiations with their employers, it was always healthcare. They needed healthcare. They saw the value of healthcare. They would even sacrifice getting wage increases in order to get healthcare, in order to keep their healthcare coverage for them and their families. And you can imagine, especially if they were undocumented, the only way they could get healthcare was through a collective bargaining agreement, which made no distinction amongst status or not, where you were born, what language you speak, nothing. It was pretty remarkable. That's where I learned the importance of healthcare to all of them on the ground. It's not some theoretical demand that, those on the left want. It is real. It is powerful when they get it. And so again, it's been said over and over and over again by my colleagues, Assembly members Colera, Arambula. I know this is a passion for Congressman Khanna. This issue of covering undocumented is really powerful for us here in California and for the rest of the country. It is powerful, one, for the scale of people that are going to be covered. It is powerful because we show them that they will not be left behind no matter what their status. I'm grateful and it's powerful because it shows that legislative strategy with coalition, Health for All coalition and grassroots partners on the ground are effective. It shows that we have respect for undocumented and for immigrants, whether they've been here, the majority have been here more than 10 years, or they're part of mixed status families. They all know how important and how devastating it is when you don't have health care, such as the fear that people had when COVID hit us about whether or not they should go get tested, about whether or not they could go get the vaccination. We have to prove to them over and over and over again that government in California stands with them to protect them, defend them, and include them and treat them like any other Californian. And I'll end with this a little story. When we did the announcement, the public announcement in Fresno with my colleagues and Governor Newsom about the new coverage, the governor stopped to speak to a group of seniors that were there, and they couldn't help but just sob with him, holding his hand, blessing him, and telling him there was nothing more important in their lives than knowing that now they had the security of healthcare coverage. So I want to urge you for that reason. Excuse me if I'm being partisan. no on the recall. And maybe some people are making faces. I'm sorry, but I had to say that. Thank you to CAPA, to all the healthcare advocates, to your alliance for your extraordinary work. Gracias. Hasta luego.
Mil gracias, Senator Durazo. Pleasure to have you again this year. We look forward to working closely with you again. And so each year, our CAPA board reserves 2 spots on our board for students, which is a unique strength of CAPA. Niloufar Khanna and Nimra Ahmed represent our highly engaged and motivated student section, California Health Professional Student Alliance. And that is, as I said earlier, that is a statewide network of medical, graduate, undergraduate, and community college students who advocate for healthcare as a human right. Niloufar and Nimra are members of CAPA's board, legislative and policy committee. And their roles are very important because they educate the board, they bring us up to date as to what bills are in the state legislature right now. And that is how the CAPA board then decides to support, go neutral, or oppose a particular piece of legislation. And here they are. Let's start with Niloufar. Niloufar, hi.
Hi everyone, I'm Niloufar Khanna and I am a CAPSA representative on the board. I join you from San Jose, California, and I am a 3rd-year medical student at California North State University College of Medicine. And I decided to become the first in my family to pursue a career in medicine because of my own personal experience of seeing chronic illness in my family. My mother has rheumatoid arthritis, and I've seen firsthand the physical, emotional, and financial toll that a chronic illness can take both on an individual as well as a family. And that is why I believe that healthcare is a human right, not a privilege. And that is also why I decided to join the board.
Thank you, Niloufar.
Hi, everyone. My name is Nimra Ahmed. I'm a pre-medical student. I grew up and went to school in the medically underserved Central Valley, where I studied human bio and cognitive science at UC Merced. I also just finished a post-bac program at CSU East Bay, and this is why I'm interested in medicine and health justice, and why I'm so excited to be a CAPSA representative on the CAPA board. I'm joining you all today from my home in Tracy in the Central Valley. So we heard from such great speakers today. Now let's go ahead and hear from you. We're opening up the chat. How are you guys all doing? Now we'll have a poll. You should see on your screen the first question pop up. And we're also streaming this call live on Facebook. So if you're watching us from there, you won't see the poll. So go ahead and just type in the chat.
Okay.
All right, let's see.
Do we have the poll coming up shortly? It will come up. I think Leah is working on that. So before the poll comes up, Nimra, excuse me, why don't you just go ahead and read us the questions? And then I believe that the chat is open so people can type in their answers, actually.
Okay,
perfect. Have that type of engagement. And then Leah, if it comes up, then you can pull up the poll questions. Okay, great.
Okay. I see the poll. I'll go ahead and read off the questions. The first question is, where are you guys joining us from today? First option, Central Valley, California. Second option is Northern California. Are you here from Southern California or from outside California? All right, so I'm seeing that most people are from Southern California. All right. I'm going to go ahead and read the next question now. Our second poll question. So, besides Power to Heal, if you've already seen it, which of these is your favorite healthcare movie? The first option is Awakenings. Second option is John Q. Third option is the hospital. Next, we have Patch Adams. Then we have Sicko. And the last option is Escape Fire, the fight to rescue American healthcare. All right, are we seeing the second poll question up for people to answer? All right, here, I see it up. I'm going to give everyone a couple minutes to answer. I'm seeing Sicko is a big favorite for everybody. And then I guess coming in at second, we have Escape Fire. Go ahead and type your impressions in the chat. I'm seeing Sicko is the most popular pretty strongly. All right, let's go ahead and move to the next question. Question 3 is, let's expand Medicare. What name do you think best fits what we're trying to achieve? First option is Medicare for all. Second is universal healthcare. Third is single payer. And fourth is unified financing system. Go ahead and answer. All right. Let's see what the impression is. All right, let's move through this one a little bit quickly. Most,
Oh yeah, Nimra, I was just going to say, because our next speaker is ready to speak, we'll just kind of wait for this. And if we have a chance later on in the call, we'll ask the third question. But thank you so much, Nimra. Let's go back to Niloufar Khanna and yeah, to have her introduce our next speaker.
Okay, that was quite fun. So as I mentioned, I live in San Jose, and today it is my pleasure and immense honor to introduce my US representative. So Representative Khanna is working to ensure that our nation is focused on creating new tech jobs across the country, particularly for the Americans left behind, and he's investing in science and technology to win the 21st century. So this includes job training programs, economic development initiatives, rewiring the US labor market, and debt-free college to help working families prepare for the future. He is also committed to advancing a foreign policy of military restraint and diplomatic engagement. Instead of spending trillions on wars overseas, Representative Khanna believes that we should invest in priorities at home, like Medicare for all, debt-free college, and a new 21st century infrastructure. This June, Congressman Ro Khanna, and by the way, we're not related, even though we have the same last name, reintroduced the state-based Universal Healthcare Act. Recognizing the unique position of American states to lead the push for universal healthcare, Representative Khanna's bill provides states with historic access to federal funding streams and regulatory flexibility necessary to implement and support affordable universal healthcare plans. Welcome, Congressman Khanna.
Well, thank you, Niloufar, and thank you for your leadership and all of your activism. And thank you, Beatrice, for all the work you're doing. I'll have to be brief. The situation in Afghanistan, we're trying to get still with the constituents. I represent the largest Afghan American community. And so it is, as you can imagine, quite urgent. But I did want to join to just thank you for all of the work that you are doing on expanding healthcare. I have been a proponent of Medicare for all for moral reasons. I don't think a person's healthcare should be tied to the job they have. Every human being has dignity, and it makes no sense to me that the status of one's profession would determine whether a person has health care or not. I believe in this country, you ought to have health care coverage from the day you are born. And I believe in it because of the economic costs. The healthcare insurance is a huge cost on the American people. It is making us less competitive. We put almost 18% of our GDP into healthcare. China puts 5% into their healthcare. You wonder why American manufacturers are offshoring jobs, why they're going overseas. A lot of it has to do with the extraordinary premiums that are being sucked out of our economy, depriving us of productivity gains and depriving workers of the wages that they deserve. If you look at the stagnant wages in this country since 1970, the 70s, it's all tied to rising healthcare costs. Companies are having to pay healthcare premiums instead of raising wages for their workers. And if you talk behind the scenes to the big CEOs, they'll tell you they don't want to be in the healthcare business. They don't want 30% of their payroll going into healthcare costs. It's time to take out the dead weight on our economy, the dead weight on our productivity, and have Medicare for all and have it unleash our entrepreneurship. One of the studies shows that job lock is because people don't want to lose their healthcare insurance. So there are a lot of great arguments. What is the challenge? The challenge has been candidly a lot of money coming in, scaring people, saying that somehow it's going to give you a worse healthcare outcome if you're on Medicare, that it's going to take away choice. I don't know a single senior who thinks that Medicare has taken away their choice. And you could get supplemental insurance, so it doesn't ban private insurance in any way. I believe that the facts are with the argument for universal health care. We should start with Medicare for all. We should start a single payer in the states. And your advocacy, your work towards that would very much help. But if you look at the polling on this, and state after state, actually across party lines, it's very popular. And I believe ultimately the public will overcome special interests. So that's my strong belief, and really appreciate all of your leadership on fighting for universal healthcare.
Great. Clap, everybody, put your emojis. Thank you so much, Congressman Tona. It was a pleasure having you. And thank you so much for doing a great job in Congress.
Thank you. Thank you, Beatrice, for your leadership.
Thank you. Take good care. All right, so we are right at the end of our program, but before that, of course, I have to introduce our next and final speaker. She is one of the most influential activists of the 20th century and a leader of the Chicano civil rights movement. This spring, CAPA joined the Dolores Huerta Foundation in urging Governor Newsom to extend healthcare coverage to our undocumented Californians, because we all know here that healthcare is a human right. Undocumented adults, our parents, our siblings, friends, neighbors, taxpayers, and workers, they are the largest population in California with no health insurance. Any effort towards universal healthcare and coverage, whether in California or nationally, will not be successful until everyone, regardless of status, has access to healthcare. And here is the legendary Dolores Huerta. Can we try? Okay.
Alliance for all of the great work that you have been doing to secure healthcare for everybody, not only in California, but throughout the United States of America.
Yeah, can you go back right at the beginning? Just a few
that
seconds?
healthcare is a human. Hello, I'm Dolores Huerta, and I want to thank the California Physicians Alliance for all of the great work that you have been doing to secure healthcare for everybody, not only in California, but throughout the United States of America. We know that healthcare is a human right, and it is disgraceful that the richest country in the world, the United States of America, that we do not have healthcare for every single person in our country. We know that in Europe, they do have healthcare for everyone. There's countries in Latin America that have healthcare for everyone. Even little teeny Cuba that has an economic boycott has healthcare for every resident in Cuba. So it's time for the United States to get on board, but we know it's not going to happen unless all of us work very, very hard to make it happen. We need a Medicare for all. You know, I personally had an aneurysm in the year 2000. My hospital bill was close to $500,000 because I was sick for so many, many months. But Medicare paid for my hospital bill. I never in a million years would have been able to afford that. And it's so important that we get young people into the medical field, especially young people of color, especially people that are bilingual in other languages. I am very fortunate because I have a son who's a doctor, Dr. Fidel Huerta. I have a daughter who was an ER nurse and now she's an oncology nurse, Angela Cabrera. I have a granddaughter that is also a nurse, and my grandson is also married to a nurse. So I'm very fortunate that in my family, we have all of these healthcare providers, but we know we need many, many, many more. And so that is one of the things that we have to advocate for is we know there's a huge need for nurses, not only because of COVID, what happened with the COVID epidemic. I mean, we had a shortage, I think in California, about 7 or 8 years ago, they said we need 400,000 nurses in California right now, especially bilingual nurses, because we know that our Latino population, as has now been shown, is really growing in the state of California. In many places, we are the majority, but we don't have nurses. And if we have to import nurses from other countries, and they sometimes do not meet the standards, according to my daughter, that our nurses have to meet. And we know that there's not enough teachers available for nurses. There's not enough classrooms available. There's not enough, again, educational support, scholarships for especially young people that are not wealthy, for them to be able to go to medical school and to get their doctor's degrees and their nurse's degrees. So anyway, we have to just keep working very, very hard. Our foundation has been doing the healthcare work in the healthcare field. And in terms of just trying to get people vaccinated against COVID-19, we have had people canvassing. We have had 100 people going door to door in 3 different counties here in California, getting people signed up for the vaccine. We have had vaccine clinics, and we have them every single weekend. And we also have sent out mailings, passed out door hangers to everybody, explain to them how important that it is that they get vaccinated, because we know that the only way that we can control COVID-19 is by everybody getting vaccinated. So anyway, we have a lot of work to do, but I know one thing. I know the people here in the California Physicians Alliance, you're not tired. I have to tell you, we in the Dolores Huerta Foundation, we're not tired either. We're going to keep on working until we can get healthcare for all, until we can cover everyone, even our undocumented people, like we were just able to get that victory here, thanks to our great Governor Gavin Newsom, who, as we now know, is now facing, they're trying to take away his position as governor and overturn the election where we elected him. So we have so much work to do. And I know that coming out of this event, everybody's going to get energized and they're going to get ready and we're going to go forward. And yes, we will make it happen. We will get universal health care. We will get Medicare for all. Si se puede, we have the power to do it. We can do it. Thank you so much for inviting me to share your event. Thank you.
Yes, indeed. Si se puede. Thank you so much for your powerful and inspiring remarks today, Dolores. You are an incredible human being in addition to your leadership and for all of the contributions you have made in this world. We are honored that you joined CAPA's 56th Medicare anniversary. Next, we have our treasurer.
Dr. Tarrant, I believe you're muted.
Yes.
There we go. Okay, thank you. Much better. I don't know if you could read lips, but I'll repeat it. So on your screen right now is a QR code. You could just point your camera at that QR code, whether you have an iPhone or another kind of phone. It all works. Or you go online and donate there at the address above, or just old-fashioned mail a check to the CAPA office, 1137. Lots of reasons to do it. You heard them all tonight. Today we had great speakers. Maria Elena Durazo said that grassroots does make a difference, and we believe at CAPA that we are making a big difference. And we really appreciate any donation that you could afford going to CAPA so we can get people the health care they need, so we could advocate for more primary care physicians, more nurses, as Dolores just mentioned, so we could advocate for more people being insured and getting the care they need when they need it. That's what we're all about. That's what we've been about for the last 34 years ago, 34 years here at CAPA when we first originated the association. It's a shame it had to go that long, but hopefully we're seeing the light. As we go further, there is evidence that we can get universal health care for all Californians. And you saw how our assemblymen and senators are fighting for us all. So please make a donation as much as you can to the California Physicians Alliance. Check out our new website, just redesigned. Go through the links and find out what we're about. Read our roadmap. You can read the entire roadmap for Golden State Care on the website. Do that. If you gave once and want to give again, of course, we'll take that donation. Become a sustainer, a monthly sustainer. It's probably less painful to do it that way. And if you aren't a member of CAPA, please join our association as soon as possible. We'd love to have you as a member. And look forward to our programs too on Tuesday night, run by Dr. Gordon. And you can find that information as well on the CAPA website. Thank you. Hillary?
And I want to thank everyone. It's been terrific that you've stuck with us this long. Many, many thanks. And I just have gone in and I've upped my donation, and I hope you all can do so as well. And as we said earlier, this is, as Bill Tarrant told us, it's not only giving to CAPA, but it's giving through CAPA to support all of our values. Us physicians, we have seen too much suffering right at the bedside with people who don't have adequate healthcare insurance. It's really quite painful, quite awful. So here, CAPA's made great progress over the last 18 years that I've been involved, and is very, very worthy of any support you can give. So please open up your wallets as best you can, donate, and please just follow us and our activities. And any amount of money is really, really appreciated, even $1. Thanks for participating, and thanks for being with our event.
Great. Thank you so much. And thank you to everyone for participating here. Of course, thank you to our featured speakers. I am so inspired to continue joining forces with all of you and continue fighting for a true, equitable, just, and anti-racist healthcare system. I'm sure that everyone on here is also inspired. And from the bottom of my heart, I want to say thank you so much to all of our event patrons. And you will see their names here. Thank you so much to our host committee members who took the responsibility to share this information with all of you and to invite people to attend our event and to make donations. Thank you to our members, our supporters, our donors. Thank you to all of our volunteers who have been assisting with the logistics and the details of this call/webinar. A huge thank you again. Just to everyone who I just did not name. We look forward to connecting with you. Onward and adelante. Sí se puede. Happy Saturday, everyone.